Welcome back. You're still watching The Agenda on the SABC News channel, still live to you from the Nelson Mandela Square here in Sandton. And this is on the sidelines of World Health Day today as we bring you this special edition of the show. Now, as we continue conversations around staying healthy and being healthy, which is also the theme, I'm now joined here to further have conversations with me by Dr. Hannah Bekele, who is a nutritionist from the World Health Organization. I'm joined by Mxolisi Masango, who's the head of the Secretariat of the AU Commission on COVID-19, as well as Dr. Emmanuel Taban, who's a pulmonologist. Thank you so much for your time on The Agenda. Welcome.
Thank you so much for having us.
Thank you, Ben.
Dr. Hannah, I'm going to start with you. Let's talk about the role nutrition plays, and what would you like to see in terms of Africa achieving its full-on potential when it comes to nutrition to ensure that the continent, is in a good space?
Thank you very much for that question. I would like to see the continent do quite more in terms of ensuring better outcome for nutrition. Mm-hmm. The first thing is that all member states should really put the environment favorable for implementation of nutrition program, which means like they should be looking at their nutrition plan and make sure that they revise it to address the double burden of malnutrition. And also, I think they should engage communities in the design and implementation of the plan, as well as also have dialogue with the partners to engage them and create that governance system to coordinate multi-sectoral action for nutrition. This is something everyone should be doing. The second one would be like including those nutrition interventions into the health sector programs. It should be part of the universal coverage of health services, and it should also be like all the relevant activities being included into child, adolescent, and maternal health. But this is not limited only for health sector. Nutrition is a multi-sectoral problem and program as well. So the government should also engage other sectors to support the achievement of nutrition outputs. That means like including their indicators into that, and also nutrition intervention into sectoral programs. It is also very, very important to look at the capacity on the ground. So mapping of the health workers as well as the nutrition workforce is very important, and then build a system to train them and take part in the intervention as well as coordination and management. Last but not least, I would like to see that the data system be put in place, because we need to monitor both our programs as well as policies. This is where accountability comes in, and we need to report on our national target as well as global target, how far we are. Mm-hmm. This is very critical in terms of seeing how countries should be moving towards achieving the SDG goals. If not, I'm afraid we will not be achieving the goals. We need to pull up all our sleeves and then make sure that things are done in coordinated manner. Thank you.
Dr. Mxolisi, this is where I also need to bring you into the fold. I mean, COVID-19 has had a huge impact to the continent, especially when it comes to, the economy as well as health. Tell us more about this.
Yes, absolutely. Thank you very much for the question and for having me here. I think what has characterized COVID-19 and the Spanish flu, which have been sort of the two major pandemics of this century, and I suppose in the past century, is the interconnectedness of humans across the world, mm-hmm. in the industrial area and now into the sort of fourth industrial revolution. And what this has meant is that our problems are also your problems across the oceans. However, what we saw during the COVID-19 pandemic is that despite a lot of posturing and a lot of political declarations of collaboration, there was a tendency to actually, when it came down to the crunch, to focus on your sovereign issues. And I think what we have learned, and my sister here from the WHO will tell you, is that we have all learned that this is no longer going to work. And we need to actually have an order, a health order that is a lot more collaborative. And in our industries, we talk about our One Health approach. And this One Health approach speaks to exactly that. you have to consider the environment, you must consider what happens in the agricultural sector and all of that. You must consider what is happening with animals, and then you must consider what's happening with humans, because all of these things interconnect ultimately to actually then determine what the outcomes are. And that's why we saw during the COVID-19 pandemic very acutely, very fast spreading pandemic, and it acutely affected our environment and our economy as well. So we have learned that all of these factors need to be taken into account, and that there needs to be tighter coordination around these various sectors, not just a public health approach, but an approach that really, as she said, is a multi-sectoral approach that ensures that every single element of society that determines the health and economic outcomes is addressed, and then there is tight coordination around that, and that there are agreements, binding agreements, that ensure that sovereign states actually do collaborate to ensure that they are the best outcomes that we can get out of a crisis like this, and to ensure that during fallow periods we are able to maintain a high standard of care for everybody and all citizens across the world.
Wow, that's an interesting point that you're making, which would lead me to my next question. I wanted to know from you, Dr. Lwazi, now that we're seeing the state of disaster has been moved by the president, there's a possibility of a fifth wave. What do you think Africa needs to do in order for it to be better prepared for this possible fifth wave?
Absolutely. So yes, there's the threat of a fifth wave, but the fact of the matter is that another pandemic will come. There will be another virus or another type of threat, it could be nuclear or whatever, that could really, threaten our health. So we must be prepared, and we must be better prepared. So what we do is that we have, what the region has done is that it has actually looked at the leadership that President Ramaphosa provided when he was the chair of the AU in 2020. He established quite a number of mechanisms like the AVIT, the Medicine Supplies Platform, and also strengthened and elevated the stature and ability of Africa CDC to actually execute its mandate, amongst others. We don't have time to go into everything. But the point is that what he did was that he harnessed the power of regional mechanisms and regional talent. So what the AU has said is that we need to build on this, which is why they appointed him the champion on COVID-19, to be able to actually build on the mechanisms and the institutions that he established during the COVID-19 pandemic, and ensure that, again, those are actually institutionalized, they're brought together under one umbrella, and they are able to firstly respond to a pandemic that is of importance to the region, but also they are able to, during fallow periods, prepare the region for whatever other onslaught is going to come. So we have said then in the AU that we must bring all the member states together to actually come to an agreement on how we are actually going to organize all of these institutions that have really assisted us during the COVID-19 pandemic, collaborate with other institutions like the WHO as well as other multilateral organizations, interact with the global arrangements that are being made right now, and very importantly, do this through a consultative process that ensures that all stakeholders and communities, civil society, labor, etc., are able to actually feed into this process so that we know on the ground what it is that they desire from us.
Indeed. Dr. Thabani, this is where I also need to bring you in. I want you to talk to me about some of your biggest lessons from COVID-19.
Thank you so much. I think for me, COVID-19 has been a blessing in the sky. I've learned so much, and I learned 3 lessons that stand out. One of them is that, if you compare with on the 1st of February 2020, when the COVID the first case was diagnosed in Egypt, everybody in the world was fearful for Africa, because Africa has no infrastructure, no healthcare system, no ICU facilities, and we are told that mortality in Africa was going to be very, very problematic. Means COVID was going to wipe us out completely. But if you look in terms of mortality, actually Africa has done very well as compared to the rest of the world. We having almost 1% of mortality compared to the first world country, despite all our shortcomings. And the reality is that not because the African government, AU, or all those sectors have done something special, which I don't believe in that. What actually saved Africa the most was what we call demographic dividends. Because Africa has the youngest population that actually saved us from COVID-19 in terms of mortality. But economically, of course, we fell. And what does that mean? Obviously, what I would say to the African leadership, the AU, was saying that, you know what, COVID-19 is actually a blessing for the continent, has presented us with a gift in terms of the youth dividends. And unfortunately, the youths of Africa, if you look across the continent, they are source of instability, lack of development. You know, you can go endlessly. We are not, the youths are not involved in education, in kind of innovation, all of those. So basically what I'm saying that let African government, the AU, they need to skill our youth, involved in the kind of solution that will probably prepare our youth for the next kind of pandemic. And I think possibly that need to be done. And of course, the second lesson that I learned is on the personal level. You know, it's, what I would say that, you know, COVID-19 has taught me that the solution in Africa is not going to be coming from the West. It's not coming from external, but that solution will come from us. Means each and every African child, woman or a man must ask themselves, what am I doing so wrong that I'm not doing well in my own continent? Why are Africans not progressing? Why aren't we producing vaccine? Why are we suffering nutritionally? So the solutions will come from within, of course. And I think for me, that's what Africa needs to do. And then, of course, the lastly thing, I mean, if you look the issue that a majority of people that have died with COVID-19 are people that are diabetic, hypertension, cholesterol, dyslipidemia, inactive life kind of style. And again, you ask yourself, what's the problem? It's again, that's a personal question. Everybody needs to kind of exercise. They need to have nutritional. And if you look at nutritional part, I mean, the food is not readily available in Africa. Majority of the people in this country, they live beyond the poverty line, which is a big problem. And that again, if you go back, it goes for the lack of skill to the youth. We are not productive enough, we're not producing enough jobs, and you know, the list also goes endlessly. So it means we must appreciate what COVID-19 has taught us. Yes, fifth wave is coming, but it's going to be lightly. I think we need to focus now for the next pandemic that is coming, and that means the focus should be more on our youths rather than for other aspects.
Dr. Emmanuel Tabane is a pulmonologist, as well as Dr. Lwazi Manzi is the head of the Secretariat AU Commission on COVID-19, as well as Hannah Bekele, who is a nutritionist for the World Health Organization. I have to thank you so much for your time on the agenda this afternoon.
Thank you very much.
Thank you.
Thank you very much. Well, Simpiwe, it seems like that's it from us here at the Nelson Mandela Square in Sandton for this morning. But of course, it seems like you will be coming back to us a bit later on. That's why we have to hand back to the studio in Auckland Park for more on the agenda.
All right, Mxolisi, thank you so much for that. Mxolisi Masango is out in Sandton, where the the APCL is holding its World Health Organization's World Health Day.